Duchenne muscular dystrophy, also known as DMD, is a genetic disease that affects boys and is characterized by progressive weakness and degeneration of muscles. This movie tells the story of the cost of DMD. Stories contain an exposition, a rising action, a falling action, and a resolution, with the conflict and the climax being the two turning points of the story. Unfortunately, the story of the life of a person with DMD is altered from this structure. The life of an individual with DMD starts out very much the same as everyone else. It is not until around the age of 3 or 4 when they experience the devastating conflict of being diagnosed with Duchenne muscular dystrophy. From that moment forward, that boy begins the unfortunate rising action that will make up the rest of his life. The progression of DMD can be characterized by 4 main stages. Early ambulatory, which occurs around childhood, late ambulatory, which occurs during late childhood, adolescence, and young adulthood, early non-ambulatory, which defines the adolescent young adult period of a person with DMD, and late non-ambulatory occurring during adulthood. This is followed by death, which usually occurs during that individual's 20s. Unfortunately for these individuals, there is no cure or treatment yet, thus no turning point for the conflict of DMD, resulting in many efforts to try to find a treatment that will allow the life story of a patient with DMD to reach a long and healthy resolution. However, while progress is being made, it is important to understand the current situation of life with Duchenne muscular dystrophy and the costs that come with it. So, what is the cost of Duchenne muscular dystrophy? Studies have found that the cost of healthcare for a patient with DMD is 10 times that of a healthy individual. And as patients with DMD age, those costs increase. To understand this drastic difference in the cost of DMD and the increase in the cost over time, it is important to understand where those costs come from in relation to the disease's progression. There are many costs associated with DMD. Financial costs can be indirect or direct. Some of the direct costs include, but are not limited to, healthcare professionals, tests and assessments, medications, aids and devices, and non-health services. In addition to financial costs, there are also emotional costs of DMD. These include the emotional costs of the DMD patient himself, as well as his parent and or caregiver. Let's start by looking at the emotional costs of DMD. During the early ambulatory phase, the DMD individual faces a low emotional cost. This is because he is too young and asymptomatic to understand what is going on. The emotional cost for parents or caregivers at this stage deals mainly with coping with the diagnosis, as well as family planning in regards that the mother could potentially be a carrier and it could affect other family members. As the disease progresses to the late ambulatory stage, the emotional cost of an individual with DMD gets bigger. At this stage, individuals with DMD become more aware of their limitations and differences. This can lead to feelings of sadness, anxiety, and even frustration. These feelings can also be observed in the parent and caregiver. As the disease progresses into the early non-ambulatory stage, there is an even greater emotional cost. At this stage, most patients with DMD are wheelchair-bound. This loss of independence has a heavy emotional burden. In addition, because of steroid treatment, many patients have delayed puberty, which also has an emotional cost. At this stage, caregivers or parents usually experience stress, anxiety, sadness, and they have a decrease in their free time, which is also important to their well-being and emotional health. As the disease progresses into the late non-ambulatory stage, independence decreases even more and the need for help is even greater. This can lead to feelings of helplessness, sadness, anxiety, and even frustration in patients with DMD. As well, these emotions also translate over to the parents and caregivers. In addition, parents can also start feeling helplessness as they age and become more limited in the ability that they have to help their child. Indirect costs account for all the costs that are not contributing to the direct treatment or services required for DMD. Indirect costs include loss of time working, which contributes to loss of income and funds, as well as loss of economic utility. As we can see, as the disease progresses throughout the 4 stages, there is an accumulation of indirect costs. These costs can be contributed to moving or traveling to be closer to care, increase in time and number of health visits, which requires parents to take more time off of work to be at these visits, and loss of independence in the early non-ambulatory and late non-ambulatory stages requires increased time from parents and caregivers to help take care of an individual with DMD. Healthcare professionals are crucial to people with DMD. Throughout all the stages, there is a consistent amount of healthcare professionals that need to be seen, but as the disease progresses, so does the number of visits to these healthcare individuals, contributing to a greater cost over time. These healthcare professionals include, but are not limited to, neurologists, cardiologists, pulmonologists, psychiatrists, psychologists, orthopedists, dietitians and nutritionists, and therapists including physical, occupational, and speech and language therapists. The monitoring of disease progression is imperative to the care for a patient with DMD. In the early ambulatory phase, carrier testing can be done in the mother to see and determine if she is a carrier for DMD. Genetic testing can often be very expensive. In addition, pulmonary function tests are performed to assess lung health in patients with DMD, as well as echocardiograms, which are important for monitoring the development of cardiomyopathy seen in patients with DMD. Additional assessments include assessment of height and weight, as well as a bone density scan to make sure that bone health is in good shape. While there are no treatments or cures for DMD, medications play an essential role in aiding patients with DMD. The amount of medications and over the time they are needed results in incurring high costs. And eteplirsen, otherwise known as Exondys 51, is an exon-skipping therapy that has recently been approved for Duchenne muscular dystrophy. This treatment is estimated to cost around $300,000, but depends on different insurance companies as well as the stage of muscular dystrophy. Some insurance companies will not cover in patients who would like to try Exondys 51 after they have become wheelchair bound because they seem as it is not necessary. This means that patients who are willing to try Exondys 51 but do not have insurance to cover will have to pay this cost out of pocket. Medications are not the only things that people with DMD need in order to live their daily lives. As the disease progresses, so does the length of the list required for aids and devices that are needed for people with Duchenne muscular dystrophy. These aids and devices are already very expensive, but people with DMD require almost all of them, which requires a high cost. The last category of costs directly associated with Duchenne muscular dystrophy include non-medical services. This includes things such as food and diet. People with Duchenne muscular dystrophy, because of corticosteroid treatment, need to be getting nutritious, well-balanced meals. Unfortunately, healthy food is much more expensive than unhealthy food, leading to a higher cost. Another cost that is incurred is transportation. These costs can come from anywhere such as inability to take public transportation, a cheaper option due to wheelchair inaccessibility. In addition, students with DMD often find themselves having difficulties in school. This can be resolved or alleviated by hiring a private tutor, but yet that is another cost that needs to be incurred. As we have seen with other cost categories, the costs in the later progressive states of Duchenne muscular dystrophy are much higher and much more than in the earlier phases. After careful analysis of different costs at different stages of Duchenne muscular dystrophy, we can see that the cost of DMD is much greater than in healthy individuals, and that as the disease progresses, there are more and more costs to consider.